Hello, everyone. My name is Sandra Tomé, and I'm a postdoctoral fellow at the Lab of Neuropathology led by Professor Dietmar Tal at KU Leuven, Belgium. And I'm here today to talk to you about tau and TDP-43 synergy in Alzheimer's disease with late NC. So several studies have shown that TDP-43 pathology in AD is associated with smaller hippocampal volumes, worse cognition, and a longer disease duration. And also that AD patients with TDP-43 pathology have a higher loss of gray matter when compared to those without TDP-43 pathology, suggesting a major role for TDP-43 in Alzheimer's disease. Besides this, tau and TDP-43 have been found to be associated in AD, namely that the spread of TDP-43 lesions in the AD brain is similar to that of tau. And also some studies have observed an association between tau and TDP-43 lesions and also a synergy between tau and TDP-43 pathogenic mechanisms. So for this, we sought to investigate the association between tau and TDP-43 and also their synergistic effects in AD cases with late NC. So first, we sought to measure the colocalization between tau and TDP-43 in preclinical AD as well as symptomatic AD cases with late NC. Also to investigate the interaction between these two proteins. And finally, we wanted to investigate the seeding and synergistic effects in vivo between tau and TDP-43. And for this, we used TDP-43 transgenic mouse model. So first, we observed a high extent of colocalization between phosphotau and phospho-TDP-43 already in a preclinical asymptomatic phase of AD, as you can see here. So we observed up to 70% of TDP-43 positive lesions that were also positive for phosphorylated tau in preclinical AD, and in symptomatic AD up to 80%. So this colocalization was quite high in both instances. And interestingly, this colocalization was only observed with C-terminal antibodies, so not only the phospho-TDP antibody, but also the non-phosphorylated C-terminal antibody, and interestingly, not with the N-terminal TDP-43 antibody. Besides, TDP-43 was also found to be colocalized with mature tau species, as you can see here in this Gaulish silver staining. So then we further validated this interaction with other techniques. So first with the proximity ligation assay, in which we confirmed the colocalization between these two proteins, and also with immunoprecipitation using patient-derived material, as you can see here, specifically in symptomatic AD cases. So then we investigated the synergistic effects between tau and TDP-43 in vivo. And for this, we used a TDP-43 transgenic mouse model. So we used patient-derived homogenates, specifically sarcosyl insoluble fractions from controls, AD cases with and without TDP-43 pathology, FTLD TDPKs, and also we used PVS vehicle to control for injection effects. So we injected into the left hippocampus of these mice at 1 year of age. And 4 months post-injection, we checked with phospho-TDP and phosphotau antibodies. And unexpectedly, we did not observe any TDP-43 seeding, which suggests that this mouse model could constitute a loss of function model. But we did observe some tau seeding, which is what you're observing here with an 88 antibody, specifically in the white matter band above the hippocampus, as represented here by the arrows. So we quantified the positive area for this 88 staining, and we saw that the tau seeding was significantly increased in the AD injected mice when compared with the remaining groups. And interestingly, that the AD plus late NC injected mice, the seeding was even more increased. And more interestingly, that this seeding was also spread to the contralateral side, so the non-injected side, which suggests that the presence of TDP-43 seeds influences the tau propagation in this model. So finally, the conclusions of this work. So on one hand, we show that there is indeed an interaction between TDP-43 and phosphotau during AD progression already in a non-symptomatic stage. and that TDP-43 seems to influence the tau pathogenesis in vivo, which leads us to the take-home message that TDP-43 pathology in AD or late NC does not seem to constitute just a bystander, but also an active player in AD pathogenesis. Thank you very much for your attention. And finally, I would just like to acknowledge everyone that was involved in this work.